Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. This is update number 40. It's coming to you live on Thursday, May 7, 2020 at 12 noon. I'm Steve Triffletti, your Plymouth Town Moderator, and we will be here each day, Monday through Friday, at least through May 18th at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For today's questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants will be joining Ken, Matt, and me, and they include Dr. Phillip Triffletti. He is an attending physician at Beth Israel Deaconess. Tim Cruz, he is the Plymouth County District Attorney. Kathleen LaNatra, she is a Plymouth State Representative. Also joining us, Steve Cole, and he is the Executive Director for the Plymouth Regional Economic Development Foundation. We date stamp these forums each day so that you'll know that it's live. And we're bringing in officials and experts in order to help all of us understand and respond to COVID-19. We're going to begin with the chair of the Plymouth Board of Selectmen, Ken Tavares. Welcome, Ken.
No.
Ken, you got to unmute.
Whoops.
And here he is. Yeah, we can hear you.
Go ahead, he's fine, he's fine.
You're fine, Ken. Go ahead.
Oh,
Talk to us.
okay.
Thank you.
All right. Thank you. I think this was the first time.
Live TV. Here we are.
Okay. Within the last half hour, I've had the opportunity to talk to the Chief of Staff of the Senate President. And we have been informed that the election for the Senate seat vacated by our former senator is going to take place on May 19th. The election is going to proceed. With the moderator's permission, we will invite our town clerk back tomorrow. He did an excellent job informing people on how to get a ballot and vote prior to the 19th of May. So if that meets with your approval, Mr. Moderator, we will have Mr. Pizer on tomorrow. But the election is scheduled for the 19th.
Thank you. Ken Tavares, Chair of the Plymouth Board of Selectmen, and I've already sent him an email, so hopefully be able to make that happen for tomorrow. Each Thursday now, we do welcome for our health portion of our program Dr. Phillip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve. Thanks for having me again on your program. It's a pleasure to be here. I wanted to start off with just some breaking news, which in this digital age, we all get it very fast, but the governor has now announced that the golf courses in the state of Massachusetts may open, and I think that's great from a health perspective as well as a number of other perspectives. I do think, getting our outdoor exercise right now is probably, one of the best things to do both for physical and emotional health. And what I'm reading anecdotally in the media, of course, is, as I suspected, we think the risks of COVID-19 transmission when you're out exercising and passing people in the fresh air, very, very low remote risks of infection. I think much better than you might find indoors in a gym, for example. So very exciting news for all the golf enthusiasts out there. They will not be allowing any golf carts, although you may be able to use your own pull cart for your golf bag, and the golf courses will need to be set up to pay online to take the fees, for the greens fees from their customers. And so they anticipate that it may take a few days for courses to get their employees in place to, offer this service to the public. But I know, of course, in Plymouth, we have a lot of golf courses, very nice ones, and I'm sure a lot of people will be excited to add that to their list of activities. I did want to speak a little bit today. I hadn't talked about this in any past segments, but I did want to talk a little bit about televisits, and I'm sure many of you may have already had the experience now that you're getting televisits with your healthcare professionals. And, it turned out before the pandemic, we had very limited abilities as physicians and healthcare providers to bill for these types of services. And so there wasn't a lot of incentive, I think, on the healthcare sector side to really push the use of these services. But myself, like many of my colleagues, I have developed a platform, shortly after the pandemic hit, to allow myself to interact with patients with the audio and video link, which is linked to my electronic medical record. And I've actually talked to some experts also in this field. It may not provide a great deal of extra benefit compared to just talking on the telephone, but I think there are some circumstances where, it may be helpful. And certainly if a patient has a rash, as I had a patient this week who had a tick bite and was concerned about Lyme disease, and he could actually show me the entry site where the tick had bitten him on his leg. And that was very helpful because we look for some characteristic findings for rash and things. So the visual component sometimes does help the doctor with, their diagnostic impression, what to do to help the patient. But myself, just like with many of my colleagues, not every patient can only be serviced by being on a televisit platform. So I had a case last week where a patient called me with swollen legs, and that's a little bit more involved. I didn't feel he was sick enough that he required a emergency room visit. So I did see him in the office where I could do an EKG, lab work, urine test. I could listen to his lungs to make sure there was no fluid accumulation, et cetera. So there, selectively, I still do see patients in the office, but I am doing about 95% or so of my interactions are now on the televisit, telehealth type platform. So I do encourage people to use that, with their, whether it's a primary care doctor or specialty doctors. I think it's a great way to communicate. And many of us speculate that, after the pandemic, that it will probably remain in our toolkit as, one of the ways that we help patients when they're sick. I still am seeing a great improvement in testing resources in the community for the PCR nasal swab test. I'm finding it more and more easy to refer patients. On the BID Plymouth website, they're still just saying, contact your primary care physician. But I have in a few cases even been able to get asymptomatic patients without any symptoms tested if needed for employment, as an example. So I do think that you're going to find, like the communities of Somerville in Massachusetts, Los Angeles City in California, that you're going to start finding more on-demand testing available to the public. And I think that that's a welcome change. The issue around antibody testing, I would still say it's not completely clear yet what role this will play for us. And on the medical side, it's really most for patients who may have had a PCR test, the nasopharyngeal swab, performed. If the nasal swab test came back negative, although there was a high suspicion of a COVID-19 infection, the antibody test could be used approximately 2 weeks later to try to confirm if somebody had been infected. And there's a few other scenarios like that where you have somebody who's been probably infected and you want to prove it for different reasons. That seems to be the biggest benefit of the test right now. And there may be some good uses of it also, I think, going forward with the social reopening of certain segments of the economy and businesses. I think there'll also be a role, but I think this is yet to be defined. As far as the ER care, I explained to you in past segments, that about 50 to 60% of the previous types of numbers of people being seen in the emergency room, if you compare to 2019, that's about what they're seeing right now. So there's still a big drop off, but I would continue to encourage people, to, not hesitate to go into the emergency room if it's necessary, if you have anything that might be serious. The infection control practices, the separation of respiratory and non-respiratory patients, I think they're doing an outstanding job. So I think you do not have to fear that you'll get infected if you need to go to the emergency room. I did want to just talk a little bit about the impact of social distancing. I think it's very interesting looking at these curves and looking at new cases of infection. I think there's no question that we flattened the curve. I think the reason that we're seeing such a flattened descent of the curve compared to the acceleration of the curve as it was ascending towards the peak. I think a lot of this is really due to all the great work we've done in states like Massachusetts in terms of our adherence and compliance with social distancing. I think it's very clear that, if we had not done the social distancing the way we've done it, we would have certainly had, huge numbers of infection, uncontrolled outbreaks, and we would have had many, many more deaths that would have exceeded our capacity. So kudos to all of you out there who, continue to heed the expert advice to do the social distancing. I think one of the other things, thinking about why the curve doesn't come down so much, I saw one explanation recently, which makes a lot of sense, is that, a lot of workers in the state of Massachusetts, for example, are considered essential. So there actually is still a lot of traffic, social contacts going on in the essential work environment, and that may be a contributing factor. Obviously, in places like China, they had very strict isolation rules where they didn't allow any of this to go on in the Wuhan province, as an example. So I think that's part of the reason we're also seeing a slower descent in infections than you might get in a place where you have very, very strict protocols in place in other countries. As far as saving lives, I think it's good to still emphasize, probably the major treatment that we have to save lives is the use of giving oxygen, intensive care unit treatment, specifically most of those treatments with ventilators, that we probably are saving about 50% of the severe infections from dying by virtue of having this type of technology available to us. Again, the reason the social distancing has been so important during the peak periods of outbreak, we don't want to exceed our capacity to provide those services to people when it's needed, as happened in places like Italy, New York. I also want to just say again, at BID Plymouth, being part of the Beth Israel Lahey Health Network, I mean, they have done a fantastic job integrating the services among all the different sites within the network in Massachusetts. So I think, Plymouth is making a great contribution, as well as, the beneficiary of a lot of support throughout the network to coordinate services throughout the state. So I think that's working very well for the Plymouth community. But I do want to just say that while I feel ventilators are life-saving, we still don't really have anything on the medication side that I really feel is making a huge impact probably on overall mortality. So that just gets back to, continuing to do our social distancing, physical distancing is one of our major strategies to, help prevent infection and deaths from this, terrible pandemic. Talking about community spread, I did see, more statistics in the media this week about, for instance, in Boston, I think they had about a 32% on 100 people tested at random. So again, showing that we're in some communities probably getting closer to that magical herd immunity number of 50%. I will say that I have heard some expert opinions coming out of Harvard School of Public Health that some of the experts there believe that this pandemic could actually carry on as long as 36 months. I mean, there's all different kinds of models out there for many experts, but we probably are really in this for the long haul with multiple waves, still to be experienced. And so I think we have a lot to learn about in terms of, how do we safely reopen society? You may have noticed in the media with a lot of states doing partial reopenings that, none of the states have met all 4 of the CDC guidelines. And most of them have met none of the 4 guidelines. So, I think we have to have a lot of trepidation in making these moves. Again, I want to really credit Governor Baker and the other state officials here. I think they've taken a very cautious but very prudent approach to reopening, and so I think we're going to continue on that path just a little bit longer. So, still making a plug for the physical and social distancing. That's our main strategy right now to help prevent infection and spread. Continue to be very, very careful about hand washing, sanitizer use, disinfecting surfaces, and then, of course, in the state of Massachusetts, as of Wednesday, a mandatory face covering. So that's all I have to say. And again, thank you, Steve, for having me, and I look forward to answering any questions in the chat section.
Thank you, Dr. Phillip Triffletti, a primary care attending physician at Beth Israel Deaconess. And at this time, we welcome back the Plymouth County District Attorney, Tim Cruz. Tim, welcome.
Hi, Steve. Thanks for having me back. I appreciate it. I also want to thank PAC TV and all our reps and everybody that's here today. I think it's so important to get the information out to all the people in our community, and I appreciate that, and I think the people appreciate it also. And I also want to say, although it may be a little bit premature, a happy Mother's Day to all the mothers that are out there. I think that it's moms right now working harder than ever between homeschooling and their jobs and everything else. So to Kathy and everybody, happy Mother's Day, and hopefully everybody just has appropriate social distancing, but we can all say hi and we can all visit through telecommunication. But the one thing I really wanted to talk about today that's been brought to my attention in my office, in our county, and also through other child advocacy groups is the real issue going on with domestic violence and child abuse, the lack of information that we're getting on those cases right now. And I think that, normally in the normal world, we're always, our kids are in school, our teachers, they're mandated reporters. Our doctors who perhaps are doing, general routine physicals, they're also mandated reporters, and they would report any potential abuse they see maybe some child is undergoing. And I think we all have to agree that the situation that everybody's dealing with right now is so incredibly stressful, from the sickness, from the job instability, from income instability. And you take that and you mix it all together with underlying domestic violence issues or mental health issues or opiate issues, and it really creates a real dangerous situation for our kids. And I know it's been brought to my attention from the Children's League of Massachusetts, MACA, which is the Mass Association Children's Alliance, and MOBA, the Mass Office of Victims Assistance, regarding the numbers. And although that sounds great, that our numbers are going down, but I think what we're really seeing is not a lack of child abuse cases going on, it's a lack of cases being reported. And when you look at our numbers from last year from March 16th to May 1, in Plymouth County, we had 161 51As, and that's the reports of child abuse and neglect. This year, during the same time period, we've had 69. So our numbers are cut more than 100%. So you have to ask yourself, what's going on with that? And what sort of exposure are our kids facing right now? People need to remember that even though courts are closed, even though it's a different time, you can still have emergency hearings on restraining orders if that's necessary. Police are there. There are victims groups that are out there to help women and children if they're in danger, if they're in situations. And I always tell people, if you are in a situation whereby you need immediate help, please call 911. And don't hesitate. If you need help, if your kids need help, if you need direction, go to the Plymouth DA's website, PlymouthDA.com. We have numbers and access to contact people and groups that can help you with no matter what the issue is, or even call our office at 508-584-8120. What we need right now is to make sure regular people are doing our responsibilities to our kids in our community. And if you see kids in your community, the kids that are there that maybe you don't see as often as you did, but now you see them maybe a little bit more, check out their physical appearance, check out the environment that they're living in. Maybe there's something there that you can get help to that child if you think that something's happening. If you're watching a Zoom in class or something and you hear a parent screaming in the background, you have to ask yourself the question, is that something that is normal? Is that something that I should reach out to the police? You can call your police anonymously. You can call DCF, the high-at-risk for high-at-risk kids, anonymously. We just want to, and you should also understand that just by calling DCF, that doesn't mean kids are going to be removed from their homes. Most times what that really means is there's going to be services brought, especially now. We're really, I think, facing challenges as never before, as we all know. And nothing's more important than helping the kids so that we can make sure that we continue to do our job and breaking cycles. I mean, we all too often in the district attorney's office and in criminal justice, we see cycles of domestic violence. We see cycle of child abuse. And it's not unusual for somebody who's an abuser of children today to have been a victim themselves 15, 20, 25 years ago. So the kids that we help today may be helping the kids in the future too. So I just appreciate the opportunity to just say a few words on that. Everything else in the DA's office is continuing on. We're persevering, doing our job, working remotely, working in conjunction with the state police, working with all of the local police officers that and fire departments and first responders who are doing a tremendous job right now. And I'm glad to see all the thank yous as I drive around to all the people that appreciate, I think, really the value that goes on, not just in Plymouth, but in our county. I think we're really lucky to live here. And we're really lucky to have officials like this that are willing to come together and give people an update that maybe they normally wouldn't have. So I would just say to everybody listening today, please keep up the good work. We're almost at the end. Let's continue to stay safe. Let's make sure we're looking out for our kids. And I think before you know it, this will be behind us. Thank you for listening.
Thank you. And that's Plymouth County District Attorney Tim Cruz. District Attorney Cruz will be with us along with the other participants during our chat session where we take your questions by sending them to us at plymouthinfo@pactv.org. Our next guest, returning Plymouth Representative Kathleen LaNatra. Welcome, Kathy.
Thank you, Steve. Thank you for letting me join again today. Beautiful sunny day out there. We'll start with that good news. The weather has been great the past couple days. But unfortunately, for the 7th straight week, our unemployment insurance claims have increased. We're now in the state of Massachusetts up to 780,000 claims. If you still have an issue with your unemployment claim, I suggest you contact my office if I represent you, or Rep. Muratore's office, and we can intervene and give you some assistance there. Our tests conducted yesterday for COVID, we had 339,639 tests conducted. Confirmed cases are 72,025, and deaths, unfortunately, are 4,420. So we seem to be testing more, and that's why we're having more confirmed cases. So social distancing and the masks are extremely important for all of us. The good news, again, that Dr. Triffletti had said that the golf courses will be open starting tomorrow. There'll be some strict guidelines. I know what I'll be doing Mother's Day, hopefully, so that I'm looking forward to that. I also want to mention there's still a severe blood shortage out there. During this time, we really need people to step up and donate blood. We'll be hosting a blood drive tomorrow here in Kingston. There's a few appointments open the last time I checked, and if you could look online at redcrossblood.org and punch in Hilltop. It's going to be at the Hilltop in Kingston tomorrow, and that is from 9 to 3. If you are able to and have the time, please check that out and hopefully make an appointment and give blood. And yesterday, we had our first formal session remotely at the State House. So we made history there. We all voted on House number 4677, and that was an act to facilitate the delay of the income tax filing. So now we will be filing our income tax in July, and that was a unanimous vote from the House. It also allows us short-term borrowing through the year because now our taxes will not be filed by April 15th and through July. But that was a very historic event for all of us. It went much smoother than I thought. I'm sure Rep. Muratore feels the same way. And hopefully we'll be doing more of that and getting some things done. But even though during COVID, we are still doing our everyday business and focusing on the bills that we filed day to day. We're working remotely. We're helping our constituents morning till evening. So please reach out if you have an issue to myself, my office, or Rep. Muratore. Thanks for having me today, Steve.
Thank you. And that is Plymouth Representative Kathleen LaNatra. And she'll be staying with us as we take your questions at plymouthinfo@pactv.org. And at this time, we welcome back each Thursday Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thank you, Steve. Glad to be back. Glad the sun is shining again. That's 2 times in a row now. So I wanted to share with some folks at home, piggyback a little bit off of what I talked about on Tuesday. During my time on Tuesday, I talked about how some things may come back to us, like tourism, as long as we don't make ourselves a hotspot for all the wrong types of activity. What we do during this nonsense will inform what kind of an aftermath we can look forward to. And that's what got me thinking about today's quote that I want to share with the audience. I won't bore anybody at home with a history lesson, but if folks are looking for something to do today, read about Bill Knudsen, a rather famous industrialist at Ford and GM during the 1900s, early part of the 1900s. Upon arrival in the US from Denmark, he remarked, when you go to Europe, they show you something that King Canute owned. When you go to America, they show you something they are going to build. That stands out to me because we're problem solvers, and we've always had a mindfulness toward our posterity. And I want folks at home to think about ways that they can make the aftermath gloat-worthy for Plymouth. If our behavior is perceived by others to be careless and unthoughtful, disregarding the safety and security for others, then people will not come here. People will not feel confident, safe, or welcome. We need to make good choices and show the region and the world what we're doing to prepare for the aftermath. And if we do that, then we will entice talent. We will welcome visitors again. We will attract investment in new and emerging types of technology and industries. We need to be the best prepared, least impacted, and quickest recovered community in the Commonwealth, because there are a lot of ideas out there, and there's a lot of raw talent, and lots of places that those ideas and talent can settle when the dust settles. So if you have a good idea, put pen to paper and start to think about what type of a business plan you would like to start. I'm here to help, and we have great partnerships with Mass Development, the US EDA, SBA, Chamber of Commerce, SCORE, and other agencies that can help build the confidence you need to overcome the barriers in your way to be successful. Now, may not feel like the right time to start a business, but it is a perfect time to start thinking about the type of a business you want to own, the types of problems you want to solve, the types of jobs you want to create for people. Right now, we're relying on our healthcare heroes. We're going to need economic heroes who help put us back to work and make us productive again. The US EDA realizes and recognizes this, and I'm glad to say that today the EDA announced, EDA for those folks at home is Economic Development Administration. They're one of the entities within the US Department of Commerce. They announced today a revision to their Economic Adjustment Assistance Program. Another $1.5 billion is going to be made available to aid communities that are impacted by COVID-19. Obviously, Plymouth is a community that perhaps might even be disproportionately impacted by COVID-19 because of the number of restaurants and tourism-style businesses that we have. These funds will support construction and non-construction, recovery planning, and technical assistance, which includes implementing entrepreneurial support programs to diversify our economy. The foundation partnered with the town of Plymouth and Old Colony Planning Council to submit an application. And I want to thank our very own state rep, Matt Muratore, for his glowing letter of support, and also Chairman Ken Tavares for being a great partner in working to leverage the town's assets with the foundation's skills. Our team knew this program was coming. We were prepared, and I'm glad to say that Plymouth was actually, I think, the first community to submit an application for this funding. I expect these funds will last a lot longer than the SBA funding. And I expect that this can help position Plymouth for long-term stability. Thank you, Steve. I appreciate the opportunity for the update today.
Thank you, Steve Cole. He's the Executive Director of Plymouth Regional Economic Development Foundation. We'll now go to Plymouth State Representative Matthew Muratore. Welcome, Matt.
Steve, how are you today? Well, leave it to a doctor to actually bring up golf in the time he's talking. You know, that was going to be my opening comments. I got nothing now. So I can see, Dr. Triffletti, how excited you were about that. So I'll give that to you. I actually, on yesterday's show, I think I said towards the end that a little birdie had whispered to me that this may be happening. So it's ironic that Mother's Day and golf are the same week. So I don't know what that says about our society, but it's good to see that happening. So yes, the golf course has opened. There is some question though about there was no guidance for handicapped golfers. So we are checking on that part of it, of that regulation now. So some more guidance will come out with that. Yeah, Kathy was right. We actually had our first historic meeting remotely. It was rather smooth, I think, how we did. So that was a good thing to do. And I think it could be a preview for Plymouth to actually, if they have to do a remote town meeting, it could be a good preview for them too. And that bill still stands in the House and has not moved from the House yet. But both Kathy and I will make sure we keep an eye on that. The Advisor Reopening Committee filed its interim report yesterday with the governor. So we should be hearing some more about that. They are still meeting with several industry groups that represent millions of people trying to get the economy back open. But however, as Dr. Triffletti indicated, there are some still hot spots in the Commonwealth. Actually, Southeast Massachusetts, the hospitalizations went below 50% of open beds at this point. So we are seeing more of an increase in our area. The good news out of it, though, the Joint Base Cape Cod will be closing down. They're going to start closing that down in the next couple of days, which means the Cape is doing much better. A lot of the resources, though, will be to the South Coast, where they are seeing a surge of cases there. So it is moving around a little bit. With regards to some of the numbers that Kathy had indicated, the increase in testing from the day before was 6,290. So a total, as Kathy said, with 339,639 folks have been tested to date, which is almost 5% of the population of the Commonwealth. And as she indicated, 72,025 have been confirmed with the coronavirus, which is 21.2% of those that have been tested have been confirmed with COVID-19. And that was an increase from 1,754 from the day before. And as you remember from yesterday, it was 13% increase from the day before that. Today is 28% increase of those that have been tested positive from those that have been tested. So it has gone up a little bit, but as Dr. Triffletti said, it's the curve is definitely flattening. If you look over the last 7 days, there have been some pretty good numbers. The hospitalizations is still at 5%. It was an increase. There were 22 more folks admitted to the hospital from the day before in the Commonwealth, with 8 more being admitted to ICUs. So the total hospitalizations are at 3,564, with 922 in ICU beds. And at Beth Israel Deaconess, today they have 70 with COVID-19, with 7 of those in the ICU. With regards to the deaths, as Kathy mentioned, the 4,420, that's over 6% of those that have been confirmed with the virus have unfortunately passed away. Another 208 from the day before have passed away with an average age of 82 years old. 60% of those have come from long-term care facilities, which are nursing homes, assisted livings, and rest homes. The number of testing that have been done in long-term care facilities, and remember there are 680 of those facilities. Testing has been done in 589 of those facilities at this point. So we are almost there, completed testing every single long-term care facility in the Commonwealth. There have been 33,416 tests conducted. There have been positive cases of 14,680 that include residents as well as staff. And remember, the population of residents and staff in these facilities is about 100,000 people. And at least there's 1 case in 331 of these facilities within the Commonwealth. For the town of Plymouth, there are 316 confirmed cases of coronavirus with 9 deaths, and all 9 deaths have come from the long-term care facilities. And in Plymouth County, we're almost at 5,900. We're at 5,899. We have increased that by 163 from yesterday, and the deaths increased by 16 from yesterday for a total of 357 deaths in Plymouth County. One last thing I do want to bring up, Steve, is the federal delegation was able to secure almost 132,000 for Plymouth County under the CARES Act to support organizations that feed, shelter, and provide resources to people experiencing hunger or homelessness. So we appreciate the federal delegation for getting that money for the folks of Plymouth County. And that is the update for today, Steve.
Thank you, and that is Plymouth Representative Matthew Muratore with his opening statement, and we're going to be going to your questions. You can send them to us at plymouthinfo@pactv.org, and tomorrow's lineup includes Ken and Matt, and we will be joined by Larry Pizer, the town clerk, who has confirmed He'll be available. Also, Dr. Barry Potvin, he is a professor emeritus at Yeshiva University. He's in the Department of Biology. Michael Botieri, the Plymouth Police Chief, will talk to us about masks. Sheriff of Plymouth County, Joseph McDonald, will be joining us, and Marie Oliva will be welcome back. She's the CEO of the Cape Cod Canal Regional Chamber. And at this time, we're going to go to our questions. And the first question is going to Tim Cruz, Plymouth County District Attorney. Tim, you mentioned that people can still go to court for emergency hearings. Currently, the court here in Plymouth on Aubrey Street is closed, and we understand it will continue to be closed until May 12. What do people do in Plymouth if they need to access the court for an emergency?
Well, first of all, it's to call the police or call the DA's office first and foremost, because the Plymouth court, what we've been seeing, unfortunately, is throughout the Commonwealth, not just our county, courts will be open and then they'll be closed within 24 hours because maybe somebody came in contact with somebody who was exposed to the virus. And I think they're trying to be very, very careful. The vast majority of any emergency hearing, however, is going to be telephonically or audio visually. That's what's going to be happening. That's what's been happening for all of our bail hearings. So very, very few cases have been going actually into court. So if somebody has an issue in Plymouth, first and foremost, you can call Plymouth, even though the building is closed for today, but I wouldn't be surprised if it's opened up early next week. But if you need a restraining order, if you need a 58A, if you need a Section 35, if you're in need of services such as that, please don't hesitate to call the police or the DA's office. And we're at 508-584-8120. And we're here to help you get those things up and running. If you are a victim or a witness in a case and you have any questions, once again, call our office. This thing is very malleable. Things are moving every day. And the courts are actually closed as are, not really till May 12th, but actually to June 1. June 1 is actually going to be the date that they're proposing for the courts to have a slow rollout as to getting back to normalcy. And our jury trials probably are not going to gear up until July 1. And that's the best case scenario as I currently understand it. So anything of an emergency nature, right now, the judges are conducting hearings telephonically and audiovisually. And if they're in a situation where something needs to be done, arraignments, bail reviews, occasionally revise and revokes, or things along those lines, probation surrenders, or arraignments from new cases. And we have seen the numbers of cases coming in county-wide really slow. I mean, in district court arraignments, which is the first time you're brought to court county-wide since the beginning of Corona, we've only had 94 arraignments. And in Superior Court, we've only had 58 bail reviews of individuals who are being held as a result of the charges, result of their own history, result of their conduct, whatever it may be. So the hearings themselves have been slowed down quite a bit. We're working out what we can in order to make sure that individuals who may have significant exposure to COVID-19, and whether or not they fit the parameters of the SJC decision that came down about 2 weeks back or so. Because at the end of the day, it's not just about the lives of the inmates inside the institutions. It's about the lives of everybody. And it's about the lives of victims too. And although, the victims cannot be invisible, the real victims here can't be invisible, and we have to make sure we stand up for them and make sure that they're protected throughout the course of this, not just from the virus, but also from people who may hurt them. And there's a reason why they're in custody.
Thank you. And that's Plymouth County District Attorney Tim Cruz. We're now going to go to Dr. Phillip Triffletti for a question from Mary, a viewer. And she writes that a friend has a home health aide for her husband who couldn't make it last week. And she asked if the woman had the virus and was told only that she was taking the week off. She was called this week to be told the woman was taking a couple weeks off, and then when asked if the woman had the virus, she was told that she did. Should the company who works with this home health aide have come up with that fact without being asked? Dr. Triffletti, it does have to do with the home health aide. Do you have any thoughts on this?
Absolutely. I do think that transparency in the practice of medicine really is very important to, gain and sustain the trust of the patients that you're caring for. So especially if you're, running a home health agency, I think absolutely you'd want to do that. I do have some patients that are in assisted living facilities, for example, and I think some of them have approached this in a very transparent fashion, which I think it really benefits the patient and their families to a great deal. There's a lot of anxiety with family members who have elderly relatives, and also the patients themselves who are elderly that rely on these services. So yes, I think unquestionably they should be transparent about this, and sometimes there might be specific contingencies that might be put in place for the monitoring of somebody who might have been exposed to an active COVID-19 patient, as an example. So they really should not be withholding that information. I think they should be letting their clients know if there's a potential exposure.
Thank you. That's Dr. Phillip Triffletti, and he is a attending physician with Beth Israel Deaconess. Each day we ask our panel to, again, after they've heard each other, come back and tell us what they'd like our viewers to remember. We're going to go now to Kathleen LaNatra, Plymouth State Representative. Kathy, what would be a takeaway that you'd want viewers to remember today from this program?
Another takeaway, we talked about the golf courses being open, but I'm sure this was mentioned, but florists are actually in business as well. You can't go into the store, but there are florists in the store, then you can order online and by phone. And it's important to reach out to our small businesses. We want them to succeed. So that was another thing I wanted to mention. And also there's public comment that you can go to mass.gov and give public comment to the advisory board on how you would like to reopen the state, the Commonwealth of Massachusetts. And again, just to reemphasize, if you are having an issue with unemployment or healthcare or something, please reach out to your state representative. They are here to help you. And
that's Kathleen LaNatra. She is the Plymouth State Representative for a number of precincts in North and West Plymouth. At this time, we're going to go to Stephen Cole, the Executive Director of Plymouth Regional Economic Development Foundation. Steve, what do you want our viewers to remember today?
Thanks, Steve. I want folks to remember that by the time most Americans are 40 years old, they've had about 10 different jobs in their career. That's an important stat I think most folks should focus on, partly also because right around 40 to 45 is when most major corporations start. One of the previous broadcasts I came on, and I gave a handful of examples of major corporations, multi-billion-dollar corporations that we rely on today to get through this nonsense. They started during times of great crisis, many of them, including great recessions. So that's a long way to say that this population in the southeast of Mass seems to check a lot of the boxes for what we normally see in the entrepreneurial climate, including the appropriate age, including also the years of experience running types of businesses. So if you don't yet or haven't yet had 10 jobs by the time you're 40, you're still way below the norm. New jobs will come out of this. And I want folks at home to, again, consider the type of jobs you want to help create for other people. Thank you, Steve.
Thank you. This time I'm going to go to Plymouth State Representative Matthew Muratore to give us an update from the governor, which may affect the comments from our remaining panel guests. Matt, if you can...
Now, getting some updates from the press conference, and a lot of it has to do with what Dr. Triffletti was talking about with testing and contact tracing. To date, they have 1,600 people making the calls, and if you get a call that reads MA COVID on your phone, please pick it up. And particularly if you have been, if you've had been tested positive for the COVID-19, you will be receiving a call. So all 72,000 people will be receiving a call. To date, they have called 14,000 of these 72,000 people to find out the tracing. And the tracing, as I think Dr. Triffletti realizes, is only going back to 2 people. Initially, they thought it may go back 10 people that you have to trace back to. So that's really a good sign. And with regards to the reopening and recommendations from the advisory board, it's very clear that we will still continue to see cases, testing happening, and cases still go up. But the tracing is what's really important with all this. Again, just to remind folks, if you have been infected with the COVID-19 and you get a call, you will get a call. Please answer the call. The area code will be either an 857 or 833.
Thank you, Plymouth Representative Matthew Muratore. And with that, we'll go back to Phillip Triffletti. He is a primary care physician, Beth Israel Deaconess. Phil, having heard from Matthew Muratore and the other members of our panel, what would you like viewers to remember today?
Thanks, Steve. The first thing I said this on one of the other segments, be patient. I do think that it's going to require a lot of patience for us as we try to have a slow reopening of society, and trying to plan for that in the safest manner possible. As you've probably heard the metaphor from Dr. Fauci, it's been repeated by many others. It won't be the light switch going on; it's going to be the dimmer on the light. Gradually increasing in intensity. So I think we have to really think about this. This is a long haul, and I think we shouldn't think of it being over in some short time frame. It's going to be probably years. Second thing I do want to mention, I'm glad that Matt mentioned about the contact tracing. I think that as we do have some slow reopening of society, that this will really be critical. And again, I think Governor Baker and our Department of Public Health are really leaders nationally on this, trying to develop a very strong resource for contact tracing, but it will be very, very important for us. And I think it's good to highlight the civic responsibility that if you have had a COVID-19 infection, that you really should respond and try to help the state track down any other potential contacts so that we can, as we reopen society, really try to do whatever we can to exert downward pressure on, further infections. Another thing I would like to mention in my summary today is just to let you know that the hospital systems are preparing and planning for slow reopening, and that we're starting to look at and trying to understand, how we can complete elective procedures and operations that have been postponed. Some of these things could be postponed for, quite some time, but some of them, not safely. Some of them need to be addressed at some more short-term intervals. If you had a patient who you were worried about might have a cancer diagnosis, and you might have postponed a biopsy of the skin or of some type of organ. You don't want to continue to postpone these things. So we are working out protocols for how we're going to do this slow reopening so it can be done safely for the patients as well as the healthcare workers. So you'll be hearing much more on that, I think, as we get to the middle of the month. And then the last thing I also want to say, happy Mother's Day to anybody out there who is a mother. And, we will also be celebrating Happy Mother's Day here in our household, of course, with social distancing as appropriate. So hope everyone has a wonderful weekend, and I look forward to seeing you all next week.
Thank you. That's Dr. Phillip Triffletti. He is a primary care physician at Beth Israel Deaconess, and I'm smiling because he and I did not talk before the program, and yet I think as brothers, sometimes we just communicate without talking. He gave me the segue to what I wanted to mention about a guest coming next week who's going to talk about elective surgery, and that is Dr. Christopher Ogilvie, and he is a professor of neurosurgery at Harvard Medical School, and he's also an endovascular and operative neurovascular neurosurgeon at Beth Israel Deaconess, and several years ago he actually happened to perform brain surgery on me for a brain aneurysm. So he'll be here next Wednesday, and he'll be talking about elective surgery as well as surgery that is not elective, such as when you're diagnosed with a brain aneurysm. So thank you, Dr. Phil. And Timothy Cruz, Plymouth County District Attorney. Dr. Phil talked about civic responsibility, which is something that you're always involved in enforcing as a prosecutor. What would you like our viewers to remember today?
Once again, thanks, PAC TV and Steve, for allowing me to come on, and everybody else for putting their information forward. I would say, listening to some of the speakers about the calls with COVID-19, I'm always very leery of phone calls that we may get. And I often tell seniors to be very careful who's calling you, because there are scammers out there, especially now. We see scammers all the time trying to use a situation where they can talk you out of your money or information. And I would go along with what Rep Muratore said, though. Make sure you pick up the phone with the COVID-19 call. If it comes up when you caller ID, make sure you get that information, because that is important information. And remember, No state agency, no federal agency that calls you up is going to be asking you for your credit card number, for your bank number, your PIN number, your social security number. They're not going to ask you for that. If they start asking you that question, you don't need to talk to them. Be very careful. But when COVID-19 comes up on your phone, make sure that you give that information, because it's going to help us in the long run. And I think that's what's really important here. Seeing people all work together, trying to make sure that, we can protect everybody that we can protect. It's a time nowadays to be kinder and gentle to everybody. And I hope that we can do that and stay safe. Everybody, please be safe. If you have any questions for my office, please go online, PlymouthDA.com, or call us at 508-584-8120. And once again, I'd also like to say Happy Mother's Day to all the mothers. Have a good day.
Tim Cruz is the Plymouth County District Attorney. And at this time, we're going to go back for a closing statement, as we do each day. Plymouth State Representative Matthew Muratore. Matt.
Hey, thanks, Steve. And District Attorney Cruz is absolutely correct. They will not ask your social security number, any information like that when they call from COVID-MA. It's actually just going to be your name and number, and they're going to ask you some questions about where you've been to see how far back and how you contracted the disease. So he's absolutely right on that. Well, another great show. We appreciate all the guests that are on, and truly enjoy working with you, Kathy, and particularly through this. It's been, we've been working 7 days a week, but in conjunction with you and with our colleagues, it's been a lot of help for all of us. I think a lot of therapy for all of us too. We're all in the same boat. We're all getting through this, so we really appreciate that. And Dr. Phil, I'll forgive you about the golf comments, but it's up to me, okay? So in closing today, again, I like to remind people to actually, remember to stay informed. Go to mass.gov/COVID-19. You can call 211 if you have any questions. You can get text alerts by texting COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. Or if you have health questions, go to OE.com/mass. Obviously, we want to thank all the essential workers who are taking care of our health, and those that are taking care of our physical health, as well as those taking care of our economic health. Stay calm, stay home. As Dr. Triffletti has said, it is working. We are saving lives by staying home, so we're all doing our part. So continue to do that. And remember, the more we come together by staying apart, the faster we'll get back to the people we love and the things we love to do. So thanks again, Steve, and to PAC TV.
Thank you, Plymouth State Representative Matthew Muratore, and to all our guests today. They include Dr. Phillip Triffletti, an attending physician at Beth Israel Deaconess. Also, Tim Cruz, he's the Plymouth County District Attorney. Plymouth State Representative Kathleen LaNatra. Also, Stephen Cole, he is Executive Director, Plymouth Regional Economic Development Foundation. And as we turn back to the chair of the Plymouth Board of Selectmen, Kenneth Tavares. Ken.
Thank you, Steve. And first off, thank you to the panelists for being here again today. Your information and how you're presenting it is so important to this community and very much appreciated. I want to remind everyone again, because I think it is so important, that the election for the state Senate seat is going to be on May 19th. We'll certainly have a lot more information tomorrow from our town clerk, but this is an opportunity for us to show that there is ways to return to what we hope will be some normalcy in some fashion. Also, I want to thank Dr. Triffletti for a couple of the comments that he made in the beginning of his closing remarks, and that is something that I really believe in and we need to do, and that's to practice patience, and that we are in this for the long term. During the day, I think anyone that's been involved with any level of government or businesses, organizations taking care of the folks in our community are working on multiple projects at the same time. But everything is starting to come together and meshing in. Later in the day today, there's going to be a 400th anniversary commemoration meeting. And some people would say, well, why are you even thinking about that a year from now? Because it has huge economic advantages that we can take care of. So while we're working with the present, taking care of those that need our assistance now, we're also planning for the future, which is very, very important. It does take, as our representatives have mentioned, I know how hard they're working. It does take countless hours, but I think that we are beginning to show progress. And as I've said many times before, we can do this. We will defeat this virus. Thank you.
Thank you, Kenneth Tavares. He is the chair of the Plymouth Board of Selectmen. Tomorrow, please join us again at noon when we welcome Dr. Barry Potvin. He is a professor emeritus, Yeshiva University, the Department of Biology. Also, once again, welcoming back the Plymouth Police Chief, Michael Buttieri, also the Plymouth County Sheriff, Joseph McDonald, and the Plymouth Town Clerk, Lawrence Pisa, Marie Oliva. She is the president and CEO of the Cape Cod Canal Chamber of Commerce, and they will all be joining Kenneth Tavares, Matt Muratore, and me. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.